Hello, friends. This isn't going to be a long post, but it's going to be an important one. Because public health has been decimated by RFK Jr. and has largely decided to pretend that COVID doesn't exist, let me let you know. We are in the middle of a fairly large COVID surge. Most of the schools in the United States went back to school over the last month. That certainly doesn't help. But just as we have in previous years, we have a summer wave. This year just is a little bit later than in other years. The amazing Dr. Hoger and PMC estimates that 1 in 49 is actively infectious throughout the United States, and that by Saturday we will cross 1 million new daily infections. Unlike the CDC map, which is blue, intentionally trying to calm you, this one uses red, a color that's meant to spur action. And the darker the red, the worse the cases. So it's bad out there, y'all. But how bad is not uniformly spread? Some parts of the country are significantly worse than others. And some may be artificially low because their wastewater sites are not reporting or they're not participating at all. But while nationally we're 1 in 49, Hawaii is still 1 in 21, meaning that their COVID cases are extremely high, something that they've had happen since June. South Carolina is 1 in 17. Texas is 1 in 19. Utah is 1 in 15. Nevada is 1 in 18. And Washington, D.C. is 1 in 26. California as an entire state is 1 in 30. But Los Angeles and San Francisco are significantly higher than that. And yeah, there are years where it was worse than this. But there are also years where it was a lot better. And right now, it's not good. And it's getting worse. Based on Swiss Re actuarial data, this means that we are in big trouble. Tens to hundreds of thousands of new long COVID cases every single day, and thousands of excess deaths every single week, in addition to the actual deaths, the over 300 that we had reported last week. And let me be clear, the ones that are reported are the ones where people actually tested and they died immediately thereafter. Those aren't the people who then died of a heart attack a month later, or a stroke, or never tested and died. But yes, they still died of COVID. And we don't really talk about long COVID anymore, but the data shows that they still aren't recovering. This study followed 816 COVID patients over 4 years. 29% of them developed long COVID. Most of them still have long COVID. This past summer, I got 5 different notifications of people who died from long COVID. Most of these people were infected in 2020 or 2021, and it took them 4 years to die. But it still killed them, which makes me harken back to HIV and AIDS. Most of the people who died in 1981 when we first figured out that something was very wrong, why we were having all of these very strange, unusual deaths in very young people, most of them were infected in 1970 and did not die until 1980 and 1981. Their acute infection was a flu-like illness 10 years before, and that's how long it took to them to reach the phase where their non-acute illness killed them. But people who have long COVID are dying now. That's half the time in a disease that many people are getting more than once. Now, I'm not saying that COVID is HIV or AIDS, but what I am saying is what I am seeing alarms me. And I don't think that we should all be getting COVID every single year. The average American has had COVID more than 4 times, and that is causing cumulative damage to our brains, to our hearts, to our lungs, to our vascular system. I think part of the lack of empathy and lack of critical thinking skills that we are seeing on a population-wide scale is a result of these repeated infections. We're having an increase in motor accidents, an increase in aviation accidents, an increase in extremely aggressive behavior. That's not a coincidence. That's a consequence. It also does not help that RFK Jr. in his anti-vax tirade has made getting the COVID vaccine extremely difficult this year. He has officially limited it to people who are over the age of 65 or those with pre-existing conditions. But his lack of approval has made it nearly impossible to get in 16 states from CVS. It's up in the air whether insurance will be required to cover it. Some states are pushing back. Massachusetts just issued a massive prescription for every citizen over the age of 5 so that pharmacies can give it to them without them having to go to their primary care doctor. They also just issued rulings that require insurance to cover it in the state. Several other states that had essentially de facto bans because it required prescriptions to get it at a pharmacy have moved to change that, New Mexico and New York being 2 of them. Other states are also banding together to try to offset this lack of scientific data coming out of the CDC. The West Coast Health Alliance includes Washington, Oregon, California, and now Hawaii, who are going to start sharing data and publishing guidelines for vaccine recommendations for their own states. A similar alliance is springing up in the Northeast. That's not cost effective, and it's truly a horrifying thing that this is what we've been reduced to. That the CDC is being run by politicians and not scientists. All the actual scientists have been fired or forced to quit. Our Director of Health and Human Services is a moron. And several states are just running off the deep end, including states like Florida, which are now removing all vaccine requirements for any age. And unfortunately, infectious diseases don't stay in one place. Having vaccine rates plummet in the state of Florida is going to affect everyone everywhere because infectious diseases don't respect borders. They don't care. So it's an alarming time to be alive. All I can say is COVID is running rampant. So is measles. If you stopped masking for any reason, now is the time to get back to it. And the better the quality of the mask you can wear, the better off you are. If you have any way to access the COVID booster, you should do so. And when they ask you, do you have a pre-existing condition? The answer is, are you breathing? If the answer is yes, then yes, you do. Because the uncomfortable truth is that anybody can be vulnerable to COVID at any age, with any level of health. And the best thing that you can do to protect yourself is to get the booster regularly, at least annually, if not twice a year. Because antibodies wane after 3 to 6 months. The best way to protect yourself is to be boosted. It's like the fucking flu shot. It only works if you had it this year. What I'm seeing happen in the United States alarms me. It also disheartens me. I'll keep trying to do the things that I can do, but please everybody, wear a mask. Even if people mock you for it, even if there's social pressure not to, your health is the most precious gift that you have. And it is not a guarantee that it will be good forever. So taking steps to protect it now is the best gift you can give yourself. Get your booster if you're able to, and keep tuning in. Pay attention to actual scientists. Don't listen to RFK Jr. or any of his henchmen. They're just a bunch of grifters who are trying to sell you shit that makes them money. And may the odds be ever in our favor.